Hi, my name is Laura Koski of eMedical Urgent Care. I'm sitting with Dr. Vince Eletto today, and we're going to be discussing audiology. Hi, Dr. Eletto. How are you?
I'm good, and how are you today?
Good, thanks. So you are board certified in emergency medicine and are a seasoned veteran in the field of urgent care. Is that correct?
That's correct.
Okay, so I understand that eMedical Offices does hearing tests. Is that right?
Yes, see, we do.
Okay. What causes hearing loss?
There are a variety of causes. Impacted cerumen, certain medications, chemotherapies will cause it. Aging causes it. Most commonly, hearing loss is due to loud noises. Somebody who would be perhaps working in a subway system would be more prone. People who landscape, they use various mowers, they would be prone to hearing loss unless they used protective equipment.
After a concert, I often hear a ringing in my ear. Is that an indicator of hearing loss or just a really good time?
No, it's just a really good time, hopefully.
Yeah.
You still have a little vibration going on. There's like a neuropraxia going on. There's a little bit of, you might say, a straining of the ear canals and the tympanic membrane, but that's going to resolve in a day or two.
Okay. How can I recognize hearing problems?
Well, you would not be able to hear someone perhaps who is speaking behind you. If you're not looking directly at that person, perhaps you wouldn't recognize the fact that they are speaking to you. You are sitting across from someone, and you may hear the noises all around them, but not from them themselves.
Does hearing loss only occur in the elderly, or is it one of those things where someone who's in their 20s can also experience it? Anyone
in their any age. Impacted cerumen, earwax, that's just clogging the ears, is going to have a hearing loss. Loud noises, any kind of trauma to the ear could cause it. People who dive, who might perhaps have punctured their eardrum from diving, would have some hearing loss from that.
If someone has a lot of wax buildup, can that be treated here at eMedical Urgent Care?
Absolutely. We could use some drops, Debrox, Cerumenex, right over the counter. We advise them to use it for 3 to 5 days. Come in here, and we'd be more than happy to wash it out and irrigate with some equipment we have.
Now, are cotton swabs good to use to get wax out?
The only thing you should put in your ears is your elbow. You should never put anything in your ears. I would advise not using cotton swabs.
Do earbuds have any effect on whether ear infections or hearing loss?
Yes, earplugs do. People who use them for prolonged periods of time, they have bacteria on them. They can rub up against the eardrum, easily transfer the bacteria.
What's the best way to clean the earbuds? Is it like just some Purell or Windex, or should you use something else?
Yeah, actually, the same way I clean my stethoscope, I dip Q-tip in alcohol, and I just go around the earpieces.
Okay, perfect. Is noise-induced hearing loss preventable?
Yes, depending on where you're getting it from. Obviously, in a concert, you don't want to wear earplugs. Mm-hmm. But if you're a landscaper, you would use ear protection. If you work in the subway system, you would want to use some form of ear protection.
What should I do if I feel like I'm experiencing ear problems or hearing problems?
Oh, you should come and see us. We would do a hearing test on you. We would examine your ears. We would do a conductive test, and we'd find out the root of the problem. Okay. Probably you're putting Q-tips in your ears.
Most likely. All right, well, thank you so much for sitting down and talking to me about hearing loss today. I really appreciate it.
That's not a problem. It's my pleasure.
Thanks.